Hi Sarah.
Hi Rupi.
So tell us what you do over in Sandwell.
I'm a clinical nurse specialist, so one of my jobs is to look after cancer patients who've been diagnosed with bowel cancer or rectal cancer. A consequence of some of those patients is that they have a colostomy or an ileostomy, so that necessitates them having a stoma bag. I've been doing it for 20 years at Sandwell and City Hospital.
Okay.
Sandwell and City Hospital is a very diverse hospital, very diverse communities, a very urban setting, and there's lots of challenges for our patients in terms of communication.
Yeah, I can imagine, yeah. Sounds like you do a lot.
We do a lot.
Definitely.
We see about 500 new patients a year.
Oh wow, okay.
Yeah.
That's a huge amount.
So Rupi, eNotes, can you explain it to me so I can explain it then to my colleagues?
Yeah, so eNotes is essentially a patient care administration system that is used by all our Stoma nursing team, and it's effectively go through the whole patient care journey, so with the nurses, so just to ensure that they're providing the right care for that patient, and it's in the form of care event screens, so like from the initial referral stage right up onto the discharge into the community. That system effectively covers all of that, so it just makes it easier for the nurses to be able to record all that information for their patients to offer them the best treatment and care possible. So eNotes also offers reporting tools as well. So to meet your trust requirements, you're able to generate reports out of the system as well. And as well as that, you've also got the ability to book appointments against clinic sessions. It's a great tool, I think, for the nurses to be able to carry out their daily tasks. How do you feel like that benefits your day-to-day role? Like, how do you feel like it helps?
We've had the computer program for about 2 years now.
Okay.
It's embedded within our systems.
Yeah.
And what we use it for is communication between one another.
Yeah.
We've got historical data that's been migrated onto that system from 10 years ago, so that's useful.
Yeah.
When that was first implemented, that was a challenge, but everything migrated quite successfully.
Do you feel like it covers a lot of things that, in terms of patient's care journey, do you feel like it covers like all the aspects of that, does it?
Yeah, you can input operation type, stoma types, demographics, day-to-day communication. Yeah. So if you was to be asked from public health, for instance, how many patients have you seen with such and such, or a stoma, you'll be able to pick it up straight away.
And even like your team members, do they find it quite easy to use as well?
Yeah, they do. Yeah, because even though it's sophisticated in what you can put in it, it's easy to use and it's easy to read, and the graphics of it looks quite easy. Yeah.
The system's bespoke, like we can always tailor it. So if there's a specific report that's not currently in the system, we can work together to build that, and then that'll be something that you could run effectively just by a click of a button once we've got that built into the report. Yeah.
And you've got the data protection elements, so you can't change things.
No,
it's password. It sits on our server.
Yeah. So it's very secure as well. I mean, we've worked very hard in terms of making sure it is, obviously with the GDPR coming into play, like in making sure it's compliant and, making sure that only certain users, obviously your team, have access to it, and it's not something that anyone can get into, and so it's very secure in that aspect. So how do you feel the eNote system benefits the patient's care journey?
What they want more than anything is good communication, because one of the biggest complaints in the NHS is communication. So if we've got all that communication there and it's written down and we can get access to it and it's easy to read without going through loads of files, and you can sort of follow a pathway backwards over weeks, months, years even. So the patient feels more cared for, so they know that people are talking to one another about them.
Right.
And it's always the right information. It also directs us if there is a complaint, for instance, or if a patient's misunderstood something, you can refer back to it and you can sort of clarify it to the patient.
I think it makes it easier for you to, like you said, refer back to those notes. So you're not essentially wasting time trying to dig up notes and things. You're more focused on the patient's care as obviously that's a priority, so you're not worried about having to go through the system, and that's good. Yeah.
And if you take a phone call from a patient, they'll want quick answers.
Yeah.
So you've got the information all there in front of you that you can refer to.
So we want to make sure that, you know, patients have the right products, and obviously with technology evolving, how do you feel that eNotes can obviously provide that?
I suppose there's a screening assessment tool that you could utilise to put sort of body shapes, skin sensitivities, shape of the stoma, spouting of the stoma, so you know what would be good and what wouldn't be good for those patients, and what they've tried before, more importantly. Because when a patient comes to clinic, if there's different nurses doing different clinics, you're thinking, well, have you tried this or have you tried that? So if you've got that record there, you can sort of eliminate things
of course,
without revisiting the same product.
So do you feel like currently, you know, the support that Salts provide you in terms of using the eNote system, do you feel like that's beneficial? Do you feel like there's ways that we could potentially improve that for you as well?
It's knowing what's available and how you can help us. And I think perhaps we could have more regular meetings.
Yeah, of course.
So for us, we could use it as a tool to measure our time, but not just time, but what we do with that time in terms of quality and quantity. Perhaps having an element of like a database of nursing terminology, not just recording what you do, but what difference that makes to that patient's journey.
Okay, we could definitely look into if that's, you know, what you feel like will make your day-to-day, you know, tasks easier.
And it's not just making it easier for communication for the patients, it's about us proving our worth as to why we do, why we paid as specialist nurses.
Of course.
Helping us with report writing and looking at what the government is asking us and what kinds of patients, what challenges. You know, we've got a very ethnically diverse community, language barriers that constitutes a lot of time, extra time that's not sometimes factored in with what you do. So it's how do we record that information, and how could eNotes help us and Salts help us to do that? Because those are the questions that are going to be asked of us. What do you do with your time? And what difference do you make to a patient's quality of life? And the difference to the patient journey.
Hopefully this chat has been, you know, beneficial for yourself.
Definitely, and I think it's good to know moving forward we can look at things about revisiting what the computer program has got and how we can develop it in the future to meet our ever-growing needs.